So we're going to be talking about ethical and legal issues in regards to a group. And so you guys have probably had law and ethics, I think, for counseling as in general. When it comes to legal and ethical issues for group, it's not that it's necessarily totally different than what you would do with an individual, family, couple, any person you would see, minor. Um, so limits of confidentiality still apply, obviously, or maybe if it's not obvious, it is obvious. Like, yes, they all apply. Um, the difference is like when we're talking about confidentiality and things of that nature, you're now, I mentioned this the last one, but you're talking about hoping that other people that are part of this group are going to keep what is talked about within the confines of wherever the context of the group is held. And that's where there is sometimes some issues. And so that is something that will come up when it comes to group stuff. Um, so obviously we have to act within our professional judgment. Clearly, we have to be mindful of people's cultural backgrounds, sexual orientations, values, or differences, things that could affect the group. And some groups will have like a interview process or selection process just to make sure they have the right candidates for the group. That won't be the case for all groups, especially open groups. And so that's something to be mindful of, that not all of that will be discussed prior when it's more of an open group, whereas a closed group, they want to make sure they have the right kind of participants. And so you might be able to weed out some potential problems or clashes that way. That doesn't make group less useful or helpful or beneficial. It's just you want to make sure you have the right people for whatever kind of group it is. And so you might be able to navigate some of that if you have that kind of an issue. So ethical issues in group membership. So informed consent is the process of presenting basic information about a group. So, helping trying to navigate, like, is this group for you? So some things you might want to talk to potential members about is the nature of the group, goals of the group, the sessions, the commitment level, what to be expected of them. Many groups are composed of involuntary members, meaning like co-parenting groups, DV groups, anger management groups. Sometimes these are court mandated or court forced type groups, drug and alcohol groups. And so you might have people who don't really want to be there. So even if they don't want to be there, there's still a level of participation that is required, how they can benefit from it despite not wanting to be part of the group. How they need to behave, attendance things, all those things, like especially if you're expected to sign off on something as a clinician, you want to make sure that the group members are participating. Even if they don't feel like they need to be there or want to be there, they still are required to participate. So freedom to withdraw from group. Procedures for leaving a group need to be explained. Members have a right to leave. Yet it's important to inform the leader. The group leader must intervene if other members use undue pressure or force any member to remain in a group. It's not about making people stay or forcing people. Remember, change is something that people have to want to have or want to get to. Maybe not everybody's ready for change, and that's okay. That's their personal choice. But we can't force people to be on the same page we are. Okay. Psychological risks for members, the misuse of power, self-disclosure, confidentiality, scapegoating, confrontation. Confidentiality, we've talked about this, the foundation of any working group. This is really the foundation of, I think, a clinical experience in general. We need to be clear as the group leaders what confidentiality looks like, what it involves. We need to talk about the consequences of breaching confidentiality. And we need to remind people that this is how we gain trust and grow as a group. And we need to be respectful of what people share in group. So if people put things on social media, what the cultural definitions of confidentiality look like, what the multicultural definitions, safeguarding confidentiality, especially for minors, making sure we're not spreading information. And this is just for the group. Like when people participate and do these things correctly, I think the group grows and there's more benefit in group. When people don't do this correctly, then there is hesitancy, a lack of vulnerability, a lack of trust. Now, in certain groups, maybe there's not like a lot of depth, but then you got other groups where, I mean, people are pouring out their hearts and souls, and then you have someone like making fun of something or sharing something about someone to somebody else. Not cool at all. Not cool at all. Obviously, you as a group leader are expected to keep things confidential, of course, unless it's a breach of confidentiality. But for group members, I mean, some people have a hard time keeping secrets, you know? And so it's just really making sure like why they need to be so protective of others' information, just as they want people to be protective of theirs. The role of leaders, values in the group, essentially be aware of your values and how they influence what you think, say, and do. Groups are not a forum for you to impose your values. We're not trying to convert anyone. We're not trying to make anybody change their political views or change their opinions or whatever. Leaders need to assist members in meeting therapeutic goals, and group members have to have the task of clarifying their own values and goals, making informed choices, and basing that on what they feel responsible to do. So here's the ACA's ethic code. Seeking consultation when struggling with conflicts of values and difficulty maintaining objectivity as a leader's problem. And this is something where supervision is so great, because hopefully for all of you, you have great supervisors and people who you really respect and value. And so you'll listen to them. And as a result to listening to them, you'll feel really compelled to ask for help when you feel like you're struggling. There's a lot to be learned from a group situation, and there can be some challenges or countertransference or things of that nature, or something you really just don't agree with, but it maybe has nothing to do with like the therapeutic process. And so being able to process that with your supervisor will be really helpful. Give you some tips and tricks, to work through that and process through that. Just because something gets challenging doesn't mean we give up. We work through it, but we want to make sure we are legal and ethical. We want to make sure our clients are legal and ethical, because we want to make sure we are protecting the group, and especially protecting the atmosphere of the group, so that we have a successful group. Okay. So there can be a lot of harm when there's diversity issues. And we could be very hurtful and treat people not right. We want to make sure that we're taking things into consideration and not doing stereotyping and things of that nature. And how to correct people if they're making assumptions about people based on their own experiences, being able to correct and redirect and work through some of those things could also help make the group feel safe, but also help someone learn and grow as a person in the midst of a group situation. Okay. Group again is very helpful, but there is a lot of room for potentially awkward or uncomfortable situations that could cause some hurt and some harm. And so we want to be as mindful of that and protective as that. We want to be mindful of our own countertransference, our own issues that come up as we deal with difficult people. We're going to deal with difficult people in group. It's just going to be a thing. And so we want to make sure we're ready and being aware of ourselves so that we can deal with some of those things as well. I hope this was really helpful for you guys. I'm looking forward to continuing this work. We're going to move on to the next chapter, but here was just some stuff about ethics and law. Take a deeper look into this. But again, we want to make sure that we are an example of what is legal and what is ethical. Again, whether we're in a group, whether we're working with a couple, whether we're working with a family or an individual, we want to make sure we are representing those things and honoring those things and doing our best to uphold those things and consulting when needed. There's nothing wrong with saying, hey, I don't know what to do in this situation. You're not being judged for not knowing what to do. And there's a lot to be aware of, as a therapist. And so you just want to make sure you're putting your best foot forward so you get the outcome that you want. So we're going to jump into a little bit of theory, and theory is like a roadmap. Theory can guide you much as a roadmap or a navigational instrument. Theory is maybe the direction or the, like it said, the map, like you kind of knowing where you're going with the group. I think groups, yes, there's process groups that are just kind of open groups, maybe don't have a lot of planning, but a lot of groups have some level of structure. And so there is some thoughtfulness and some theory usually behind it on why you're taking this approach, with whether it be addiction, whether it be some level of parenting or anger management, whether it be for a young adult or adult, all those kinds of things. So things to take into consideration. An integrative approach to group practice is developing an integrative approach as a process that will likely take years and will evolve as you gain experience. Consider your own personality, interpersonal strengths, life experiences, and worldview as you choose the concepts and techniques that work best for you. I think I always tell all my clinicians, whether it be in teaching or the ones that work for me, I'm not asking you to be something other than what you are. I just need you to do that in a legal and ethical matter, like what we talked about earlier. But you need to do things that fit well with who you are and your personality and how you come off as a person, because you want obviously your approach to be effective, and you need to make sure you feel comfortable. And if you're doing things that aren't comfortable for you, you're going to really struggle. Okay. A thinking, feeling, and behaving model. Combining the following three domains is the basis for a powerful and comprehensive group. So there's the cognitive domain, the affective domain, and the behavioral domain. A lot of group is changing behavior, giving techniques, giving strategies, things of that nature. Using group techniques effectively. So techniques are leaders' interventions. Virtually anything a group leader does could be viewed as a technique. And even how you behave in group or how you model handling a difficult situation, or like reframing or using I statements, like you're modeling all these things to the group members, which is a way of like them seeing like how to handle different situations. So you're really looked at as a role model in the group. Techniques are most useful when they evolve from the work of the group. Participants are tailored to the situation that evolve in a particular group meeting. You want to make sure that it's the techniques serve the group. They are efficient. They make sense. Again, goes with values and cultural background. The members trust you as a leader, and the level of cohesion and trust among group members. You're not going to want to do something that requires some level of trust and cohesion at the very beginning. Like when you're in the initial stages of group, there isn't been the trust or rapport built yet. And so it takes time to get there. So obviously you want to map out whatever techniques or strategies you're using that go with the level of depth that the group hopefully is gaining, the momentum the group is gaining as time is going on. Okay. That's just because at the beginning stages, everyone's just barely getting to know each other. Whereas hopefully by the end of group or towards the middle of group, there's a level of depth. So there's more trust, and then people can do different kinds of things to like push themselves in a different direction than maybe where they started. So things to be mindful of. Just like theories with regular kinds of therapy, like when I say regular, I mean like individuals, couples, whatever. There's an experiential approach, a psychodynamic approach, a cognitive behavioral approach, and then various postmodern approaches. And for a lot of you, like I said, you are going to work at places where maybe they already have the groups designed. And so you're going to learn the curriculum. You're going to maybe learn the reasons why you're approaching things that way. And it's going to probably be a little uncomfortable and new, just because anything new can be a little awkward or uncomfortable. But that's where it's going to be nice that you'll be given that curriculum so you can kind of get a handle on what to do. Maybe you'll shadow someone else leading a group so that you can kind of get a feel for it. But most modalities or methods in whatever approach or style or scenario that's coming up, like whatever the treatment is for, the group is designed for, there's going to be some level of curriculum or roadmap for you to follow. So that's really nice. And again, probably one of these types of theories is like the foundation of where they got their mapping, and theory is the foundation of a lot of what we do. It's like the foundation of a house. you need it in order to build things upon it. And so that is like the beauty of theory, is it really is where we build up from. And it's really essential to making something stand and hold. Uh, and there are going to be theories that really work well with your personality and your style. There are going to be theories that are really challenging with that. And so trying to find things that work well with you is going to be important so that you can implement it well. You believe in the process. It'll make it easier for you to explain it, and maybe to see the growing areas and also the strengths in clients. And so just things to be aware of as you go through this program, as you start doing stuff in your practicum sites, as you start doing stuff as associates, finding really what your niche is, what you like, even what theories you really get into, because those might be areas you might want to target, you might want to specialize in and grow in, because you really like and vibe with the material and how it's stretching you and growing you as a clinician. So I hope all this information was helpful to you guys. I hope you have a great week. Talk to you soon.